And so let me ask your legal permission. Is it okay if I videotape our discussion this morning?
Yes.
And I guess I can say welcome back. This is your second visit or third?
Second plus my surgery time.
Right, okay. So what we're going to do this morning, if you don't mind, is maybe just talk for a few minutes. And what we're hoping to do is that out of our discussion this morning is maybe find a little pearl, a little snippet of information for somebody who's considering the surgery. And one of the interesting things, of course, about your background is you're a medical professional, you're a nurse anesthetist.
Yes, I am.
And we're always flattered when a fellow professional chooses us to have surgery. What would you like to say if you had a chance to be on the internet, which you're about to be, and talk to anybody and everybody? What are the things that you think about the MGB or your experience with weight loss surgery? And
well, I am a nurse anesthetist. I put people to sleep for surgery 35 years now. We do the lap
started
band.
When you were 3?
Oh, yes, when I was a fetus. We do the lap band in Nashville.
Right.
We do the Roux-en-Y in Nashville. And I could have had some of my very best friends do my surgery for me in Nashville, and I chose a total stranger in Las Vegas. I could have had my dearest friends give my anesthesia in Nashville. All those things are very big pluses.
Right.
But the point was the procedure and to find the right person to do the procedure. And I chose Dr. Rutledge to do my procedure because I kind of thought there were some well-trained people that you had trained around the country. One very close to my original home in Michigan where I could have stayed with family and friends, and that was tempting. But I thought very often medical professionals, if somebody's going to fall through the cracks in some way, it's going to be one of us.
I think we've both seen that, you know, where
yes.
If you have a nurse or a doctor who's having a procedure, they
yes.
seem, for some reason,
what is that?
They're like a magnet. They get the complications. We've had that here in town.
Yes.
Just to digress for a minute, one of the leading back surgeons went to have a facelift, you know, which is generally considered not major surgery, but kind of more, not quite minor, but by one of the best plastic surgeons. Kind of everybody agrees, one of the best plastic surgeons, and the patient suffered severe brain damage just from a facelift. So. You're right. We I think have to worry as medical professionals. Somehow there's the world tilts and the nurses.
Well, us or someone we love, we take them to the hospital. They have the same risk factors that we have in that regard. And so I thought, even though I trusted your judgment and all the wonderful surgeons around the country that you had trained, I thought I needed to go to the source for this operation. And so that's, I mean, if you're flattered by that,
so we're here today at the source.
At the source. And then, you know, all of that was really reinforced because when I came, I was here in May of '05 for my surgery, and then I came back in July of '05 with a friend, and you invited me to come into surgery and observe. And my support person had been an anesthesiologist, and she had been invited to come and observe. And she was kind of dragging her feet all the way but coming with me to make sure I got a fair shake. And when she went and observed the first procedure, then you took the second one back, I was the third one, she came back to my room and she said, "Oh, Debbie, we don't worry about this anymore. You were so kind to let her." She said, and it was true, when I observed, when I came back in July with my friend when you invited me to come and observe, I did, I think, the first anesthetic for a laparoscopic procedure in Nashville as a student, because that surgeon who brought laparoscopic procedures to Nashville happened to be using the facility where I was a student. And so I've seen a lot of laparoscopic surgery, a lot of laparoscopic surgeons.
Right.
And you need to plug your ears for this, because I know you hate my anesthesiologist friend and I both agree we have never seen anyone so elegant with that instrumentation. That's true. Elegant is the word. And just smooth as a ribbon and handling the tissue just beautifully. And
excuse me.
There's a lot to be said for matching real skill on some level up with a contemporary procedure. So much as eye-hand coordination, you're no longer looking through the scope, you're watching the screen and doing this, and there's something in your brain that just matches up with that technology.
Yeah, it's my nerd titer, right?
Hey, I'll take it. I haven't heard that's exactly right.
Right.
I'll take it. It's right. And it's monocular. You know, you don't really have all that much depth perception.
Exactly.
But you sew and what you do, I have an appreciation for because right. I watch it every day and I see the good and the bad and the ugly. And I just have an appreciation for that.
Well, I can tell you that we are familiar with a lot of surgical programs, and very few, I really don't know of any, that invite other people in to watch.
No, not much.
We really enjoy that, though, because we really do feel good about the surgical technique, and having spent time doing other kinds of surgery as a general surgeon in the past, you know, with the big incisions and, you know, the lap pads that are soaked with blood, it can be a kind of a rough experience watching surgery.
Well, I think you can afford to be that transparent if you're going to be that good at it.
Right.
I have worked over the years. I work with fantastic surgeons right now, and they. I'm really proud of the work that I watch us do in Nashville. But I have seen people be transparent when they didn't know they weren't doing a good job. It's really important if you're going to be that transparent to really also be the bomb.
Right.
And you,
right.
you sir, you know, you are the bomb.
You're